In this video, I'm going to answer two commonly asked questions in clinic. Why do I have to bother with an MRI? And can I stop my MS medicine? It doesn't seem to be working. If you want to hear answers to those questions, don't turn away, because that learning starts right now. Howdy! Thanks for learning about MS with me, Boster. I started this YouTube channel to help my own MS clinic patients learn between visits. And it's my hope that through these videos, I can help you learn too. Today's topic, two commonly asked questions in MS clinic. The first, can I please skip the MRI this year? I feel fine. And the second, can I stop my MS medicine? I don't think it's working because I don't feel better. So let's jump in. Very commonly, someone with MS will ask me if we can skip an annual MRI. They say, Doc, I haven't had an attack. I feel awesome. I'm doing great. You don't find anything new on my exam, so let's skip it. This is exactly the time that I need an MRI. Let me explain. If you're someone with MS and you have an MS attack, which manifests clinically, and we hear about it because you share with us and we see it because we examine you, we don't need to get an MRI. We know you've had disease activity. It's apparent on your history. It's apparent on your physical. And we don't need to spend thousands of dollars on an MRI to teach us what we already know. Moreover, if we obtained an MRI that didn't show anything new, it doesn't change the fact that you had clinical disease activity. And so obtaining an MRI around the time of an attack doesn't teach me anything and doesn't change my management. I'm still going to want to treat with steroids, and I'm still going to be concerned that your disease-modifying therapy might not be fully working. I need an MRI in the opposite situation, when you are doing great, when you feel fine, when you look super, when you're not having a loss of function, when you're not failing a litmus test of life, and when you're not having an attack. That's when we have to look a little deeper to ensure that we don't see breakthrough disease activity on the MRI. We have to make sure that we don't see breakthrough subclinical disease activity. If I use an analogy, think about a vehicle, a car. Once a year, you're supposed to take it to the mechanic, and he lifts up the hood and looks underneath and checks out all the systems. And sometimes he'll discover a problem that hasn't manifested clinically, meaning you don't notice a problem while driving your car, but he identifies it before it becomes a problem, before you have a problem on the road, and he can fix it. Really, with an MRI, we're trying to do the same thing. If you look and feel great while taking an MS medicine, but we see on the MRI a new spot, that teaches us that we have breakthrough disease, not clinical, but radiographic. And it means the exact same thing to me as an attack. It means that the disease-modifying therapy isn't doing everything we'd like it to, and that we have had some disease breakthrough. The fact that it hasn't manifested clinically, in my mind, is a good thing, because it gives us a window of opportunity to intervene. It's my opinion that a best practice is to obtain an MRI of the brain once a year in all people with MS that are on a therapy at least up until the age of 60. Why? To make sure that we're not missing subclinical disease activity. And if we are, it gives us an opportunity to intervene, to give steroids and or to change or upgrade the disease-modifying therapy. Now let's turn our attention to the second question. Doc, can I stop my MS medicine? I don't think it's working. I don't feel any better. Multiple sclerosis disease-modifying therapies don't treat symptoms. They're drugs that prevent future bad events. And I use an analogy of a birth control pill. If you have 3 children and you start taking birth control, you still have 3 children. They don't go away. Those are prior events that have already occurred. You take a birth control pill to prevent an unplanned future event. And I like to joke, if you're not sure why you're on birth control, go hang out with your kids. Now I'm saying that tongue-in-cheek. But as it relates to multiple sclerosis, if you've suffered an MS attack, which leaves your hand numb and burning, taking a disease-modifying therapy is unlikely to make that go away. We take an MS disease-modifying therapy to prevent a future event where the other hand becomes burning. And we remind ourselves of why we take a disease-modifying therapy because of this annoying symptom we don't want anymore. I'm not using disease modification to help a 20-year-old person with MS in their 20s. I'm using disease modification in a 20-year-old person with MS to help them when they're 50 and 60, to be the most awesome version of them possible despite having MS. There you have it. My answers to 2 commonly asked questions in clinic. In a nutshell, we want all people with multiple sclerosis on a disease-modifying therapy, not to improve their symptoms. We take care of that with symptomatic management, but instead to help prevent future unplanned events, future MS attacks, and future brain damage showing up as new spots on the MRI. We want all people with MS on a disease-modifying therapy to have a screening MRI annually, at least up until the age of 60, so that we can identify subclinical disease activity, not things that are manifesting that they're aware of, but things underneath the hood that they're not yet aware of. My name's Boster, and thank you for taking a few moments to learn about MS with me. If you enjoyed this video and would like to see future content like it, please take a moment and subscribe to the channel. And as always, I look forward to reading your questions and comments left in the section below. Until my next video, take care.